recording. Should I turn off my video?
To start much, Shima, let's just go with it this way. Share screen. So year 2 of the graduate diploma, this is the way it's going to look, or at least this introduction. This is the way the introduction is going to look, and I hope by the end you'll understand what we expect of you in the first semester, and the second semester is going to be quite similar. So by going through this with you now, hopefully it'll give you a good idea of how the following 2 semesters are going to run. So we'll look at the aims, the design, resources that are available to expectations, faculty, questions. So the aims of the course are to provide you students with clear training to foster knowledge and skills and professional abilities, so that you're able to perform echoes to a really high quality. The 3 images you see are an indication of what we're really focusing on. 2D images are still, fundamental to whatever kind of imaging you do. Obviously, over time, 3D and strain and things like that are going to be more widely used. Nonetheless, 2D still remains the foundation of a lot of what we do. Doppler imaging as well, obviously. Tissue Dopplers becoming more and more widely used. The little image there at the bottom, which reads WSU echocardiography full imaging sequence. When you guys come on campus for the first time, and I'll give you the dates shortly, in April, I'll go through a full imaging sequence, which is the images that we will be expecting you guys to be able to acquire at the end of the year in an exam situation. So I'll explain that a little bit, but in short, there's about a sequence of about 60 or so images in a logical order that you guys will have to follow, and I'm sure you're very familiar with something very similar. This semester and the following semester, we're going to try and extend you guys a little bit further and do some other interesting things. As I was saying earlier, Shima, we're going to be doing some case studies, so hence the image on the right-hand side of this screen there with a case report, and then the other echo images on the left-hand side, images of an atrial septal defect, and that's just an indication that this semester we're going to be looking at some congenital heart disease. So we're trying to build on the knowledge that you guys already have, and then refine that by getting you guys more involved in the assessment process, i.e. you're not just answering questions now in an exam, but developing a case report and really showing us the knowledge that you guys have acquired and will acquire this semester. So we're going to build further on your knowledge of cardiac anatomy and physiology, but in particular cardiovascular pathophysiology. You'll be pleased to know that ultrasound physics won't be taught any further. Obviously, you still need to know the fundamental things. I mean, ultrasound physics will, at the end of the day, generate the images, but there won't be sort of any more physics classes per se. We're really trying to hone your skills with regards to how machines operate and image acquisition, as well as your professionalism too. Clinical training remains really essential, and I'll contact each of your clinical supervisors, just to, in the first place, thank them again for supporting you guys and for supporting the university. And really, I want to work with them, so I'll indicate to them the aims of this semester and the aims of the year. I'm open to answering any questions that they have. May I encourage you to continue really to make the most of the clinical training there, and try and see that as invaluable experience. I mean, obviously, it's a really important part of the learning process. This study is just to get you cheering a little bit about the fact that we're already halfway through. So there's 4 units down, 4 units to go. The structure of the course remains similar to previously. You do principles of cardiac sonography and practice. So just to remind you of what that means, is the principles is really the theoretical aspects of echocardiography, whereas the practice obviously is literally putting it into effect, the imaging components, etc., etc. The e-learning platform Views, which I hope, Shemi, you'll have access to tomorrow, is really the way that you and I will sort of communicate most things to students. So this is just a screenshot of the Views site, or the homepage that we have, and everything, almost everything is accessed from there. I post announcements regularly, so there'll be a number of announcements each week. Lectures are accessed via there. Assignments will be submitted via there. There are imaging guidelines, there are reading resources. So this is a really important thing, obviously, for us to get available for you. And there's been a lot of time and effort put into making sure that the content on this is really going to help you guys to provide you guys with access to really good material that's going to help you a lot. In terms of lectures this semester, the lecture content is not heavy at all. So as you'll see, there are 4 lectures for principles of cardiac sonography and 4 lectures for practice of cardiac sonography. Now they will be available from this week. So the first one this week is Essential Congenital Heart Disease 1, and then next week Congenital Heart Disease 2. Then in week 4 there's another. Most of them, as you'll see, are online, so you access them online. A couple of them will be face-to-face, including the one in week 5 there, when Anne-Marie Hennessy, who's the Dean of the School of Medicine, will give you a lecture on systemic and infiltrative diseases. The reason it's face-to-face is that'll happen when you come on campus at Blacktown to do some practical skills as well. There'll be one lecture that day, and I'll go into the way that they will run shortly. But anyway, these are the lectures this semester. They all happen either before or at week 10, and because, as you'll see in slides to come, the assessments are mainly due later on this semester, and for reasons I'll explain in just a moment. The textbook we'll be drawing from most is the textbook of clinical echocardiography. I'll show you how you can access the e-version from that. So the e-version is available via the library and via the Views site that I was telling you about, and you can access that 24/7. There are other texts like Feigenbaum's echocardiography, like Benita Anderson's textbook, and others. And the full e-versions are all available to you guys via the Views site. you're welcome obviously to buy a hard copy, and I encourage you to do so. But anyway, these are all available to you, and each lecture I'll indicate to you, where a lot of this material is drawn from, and which chapters of in particular Catherine Otto's textbook to read to reinforce the lecture material. On-campus things and practical exams all happen at Blacktown. So that's an image of the Clinical and Research Centre at Blacktown. It's adjacent to Blacktown Hospital. So it's where you come for the on-campus things. Typically they run from early afternoon to early evening, say from 2:30 p.m. till about 7:30/8 o'clock. The focus will be practical imaging. There'll be volunteer patients there, ultrasound machines there for you to use, and there'll be specific tasks each time. There'll be some case studies to review and things like that as well. And it's a good chance for us to get together, but also you guys to work with the other students and really refine your imaging skills. This is a document that is available also on Views with key dates for this semester. So we're now in week 2. Lectures are available starting this week. First on-campus session is Wednesday the 4th of April from 2:30 to 7 p.m. It may go a touch later than that. It may go to about 7:30. As I was saying, it's at Blacktown. The second one this semester is Friday the 11th of May. And it will be a similar format from 1 p.m. to 7:30 p.m. I'll talk to you a little bit more about that and send some announcements, but what I'm hoping that the Friday may include is the chance for you guys to watch some transesophageal echocardiograms early on, say from midday or something like that, especially if you don't see them very regularly. They'll be done really well by people who are involved in the course. Suzanne Eshu, who's a cardiologist, and Tim Tan, who's a cardiologist as well. They'll be doing the transesophageal studies, and you'll have the opportunity, we hope, to arrange things so that you can come and watch those. You can see from this as well that the assessments are due later on in the semester. Don't worry too much about that just yet, because I'm going to go through them shortly. Their due dates and things like that. So just remember, Shima, that there are 2 units that you're undertaking: Principles of Cardiac Sonography and Practice of Cardiac Sonography. Let me talk in the first place about Principles of Cardiac Sonography and assessment items. So the Principles of Cardiac Sonography, as I was saying, it's the theoretic, more theory-based kind of unit, and there are 3 assessment items: an online quiz, what's called an applied project, and then a case report. The online quiz will be in week 7, and you'll be able to access that via Views. And it's as simple as on Thursday in week 7 from 5 p.m. until Friday in week 7 at midnight, you can undertake the course the exam at any time during that sort of 30-hour time frame and answer 20 multiple choice questions in 30 minutes. So that's the way it's run. The weighting is 15%, and most people do reasonably well at those, because you can obviously refer to notes you've made and things like that. The one important thing that I would suggest is make sure that any of the assessment items you do are your work. So obviously, when you're preparing things and you ask other people for advice and that kind of thing. With regards to online quizzes, written exams and whatever, make sure you're doing things yourself. And then any case studies or something you submit, make sure that you reference things, so that, because the university is really wanting you to sort of, you know, make sure that you do things properly, you know, so that, you know, exams are your material. You're not sort of working off someone else's work, and then if you're submitting an assignment or something like that, you appropriately reference anything that you may have accessed. What I might do just at the moment is, sorry to scroll forward. I was just trying to remind myself of what to do. Is I'll just move away from that document for a moment. Shima, sorry. Let me just go here. These learning guides are available to you. Available to you via the View site. You'll certainly be able to see them, but let me just go through the marking criteria for these so that you're aware of how those particular assessment items I was just talking to you about are examined. So once again, let's go down here, and as you just saw, there's an online quiz, an applied project, and a case report. And the online quiz, as I explained, is fairly straightforward. The applied project, I'll just have to spend 5 minutes or so explaining, and then you will probably need to read through this learning guide again yourself just to get your mind around this. It'll take you a little bit of time just to work out, you know, exactly what you need to do. So once we've finished here, hopefully you'll have access to the View site, and you should be able to access the learning guides from the library by tomorrow as well too. And you'll just need to read through those when you have a chance later on in the week or over the weekend, so that you really get your mind around what is required in the applied project. The project has 2 parts. So in part 1, you develop a spreadsheet of 40 consecutive patients. So it's something that you will need to start thinking about soon. 40 patients, obviously that will include both male and female patients. Once you've got those 40 patients, separate them into 2 workbooks so that you've got male patients on one sheet and female patients on the other sheet. And then list or include 7 columns with the following measurements for each patient. Okay, so left ventricular septal diameter, left ventricular diameter, left ventricular posterior wall diameter, and left ventricular diameter end systole. So obviously they are measurements that are made from the parasternal long axis view. They are the linear measurements of the left ventricle. And they're the first 4 columns. Another column with left atrial volume measurement, another column with left ventricular septal S prime velocity, and the 7th column with left ventricular septal E prime velocity. List, as I was saying, 40 patients with those columns divided into male and female. Then, at the bottom of the columns, you'll need to calculate the mean and the standard deviation for each one of those measurements. Okay, so there'll be the mean and the standard deviation for the LV septal diameter in one column, at the bottom of one column, and then the chamber diameter in another, etc., etc., etc. And below that, you include a published normal value for that particular parameter. Okay, that's that. That's the first part of the project, part 1, and it will be marked according to this criteria over here. So, as I was saying, we want 2 spreadsheets with males and females. And if the spreadsheet is clearly marked with 7 columns and all parameters included to 1 decimal place, you can anticipate that you'll get a good mark. The calculations and the units are correct. Again, you anticipate a good mark. And if there are published normal values and references included, you'll be marked well for all of those. So that's part 1 of the applied project. Part 2, let me just come back. Did I lose you for a sec? Did I, Shima?
I think I lost you for like 5 minutes.
Okay.
And I was there for myself, and then I lost you.
Okay, I've been talking to myself. That's fine. What I'll do is I'll send you the recording so that you can just go back to that. I'm going to keep rabbiting on here, Shima, to myself. I was just describing part 1 of the applied project, which some of it you may have heard.
No, I think I lost you just after the...
Okay. So the applied project is the second assessment item for Principles of Cardiac Sonography 3. Okay. It has 2 parts. One of them is a spreadsheet, which includes 40 consecutive patients divided into males and females. So a list of those 40, I mean, the males and females will obviously make up slightly different numbers if you're doing 40 consecutive patients. There may, for example, be, 18 males and 22 females. But what you need to include in the spreadsheet are these 7 measurements, okay, in obviously 7 columns. These 7 measurements for each of the patients. The first 4 are measurements that are taken from the parasternal long axis view, and they're linear measurements of the left ventricle, linear 2D measurements, and then the others are from different, apical measurements, left atrial volume calculation, left ventricular septal S prime, and left ventricular septal E prime. So they're the 7 measurements that need to be included for each patient. For those 7 measurements, there needs to be a calculation to 1 decimal place of the mean and standard deviation for each of those columns. So what you're trying to do is come up with your own list of values, based on 40 consecutive patients, separated into male and female. And then below that, you'll include normal values for those parameters so that you can kind of have a bit of a look at how your patients compare to normal published values, okay? Then in terms of how that's going to be marked, these are the rubrics. What we expect is, as I was saying, 2 spreadsheets, 1 for males, 1 for females, with a combined total of 40 patients, and each sheet with 7 clearly marked columns. If the units and calculations are correct, you expect a good mark. The published, normal values are included, and things are referenced appropriately, you'll expect a good mark as well. So that's the marking criteria for that first part of the applied project. The second part of the project then is designed to get you thinking a little bit about 2 of the patients, okay? So you then take 2 patients from your spreadsheet. The first one, a patient with who you're going to discuss their left ventricular systolic function. The second patient, you're going to discuss their left ventricular diastolic function. Okay. The first patient, you indicate the reason why they had their echocardiogram in 20 words or less. Then you provide a summary of the findings of the echocardiogram. So the report that you end up generating, you summarize and include things like rhythm, chamber size, valve morphology, and function. You include the 7 measurements that were part of the first part of the applied project. Then the key thing is then to explain whether or not those 7 values actually reflect the patient's systolic function. So that is to say, do those 7 measurements indicate in any way, anything about the patient's systolic function? So, for example, because you've got left ventricular chamber size in end diastole and end systole, you'll be able to generate a fractional shortening measurement. You'll also be able to, because you've got it listed, you also have details of the left ventricular S prime value. So are those measurements really indicative of the function that you noticed based on all your other measurements? I hope that makes sense. What the aim of this is to do is to help people appreciate that sometimes just simple measurements aren't enough to give an indication of overall function. You do that with one case for systolic function and another case for diastolic function. And then the marking criteria are over here. If you've included the reason for the exam and summary findings, and done so as asked, you can expect a good mark. If the 7 measurements and explanations are there, you can expect a good mark. If you've given a good explanation of the patient's function with reference to the measurements that you've made, you'll expect a good mark. And that's really the most important part. It's the part that's given the highest weighting. And what I expect in that particular section is, if you've chosen, for example, a patient who has significant systolic dysfunction, but those measurements just don't indicate that, for example, if it's regional dysfunction, you may well not see that in those 7 measurements. Does that make sense to some degree, Shima?
Yeah.
Great. Okay. So that was the applied project. I'm just going to chat to you about the case report. So the case report is due at the end of the semester, and it's the most heavily weighted assessment item for this unit, for this semester. It includes 7 parts. So a title, introduction, case description, discussion, images, conclusion, and references. The task is you want to research and report a case of a patient with congenital heart disease from your own imaging practice. Now, it does not have to be one of the really tricky congenital heart disease cases. It can be something as simple as, a patient who's had an ASD repaired, or someone who's got a bicuspid aortic valve, or a coarctation of the aorta, or something like that. But anyway, someone who attends your clinic, who hopefully you've been involved in acquiring the images. So what you're to do is to introduce the case, its purpose, and the structure of the report. And then in the case description, what you're to do is state relevant clinical observations. So you describe the events of one time that patient came to the clinic that you work at, and this detail the clinical findings, i.e., their heart rhythm, heart sounds, whether they were breathless, what their blood pressure was, etc., as well as the key echocardiographic findings. If it's a patient with a bicuspid aortic valve, obviously you want to talk about the anatomy of the valve. You want to talk about its motion. You want to talk about any gradients across the valve or any aortic regurgitation in the clinical description. And then the most heavily, or certainly equally heavily weighted part is the discussion. And then that's the chance really to describe with reference to published articles the particular pathology you're highlighting in your case report. So you need to then do a little bit of research about that particular kind of heart disease, and make a good discussion about how, you know, your case compares to other published reports. There are images that you need to include, so 4 to 6 high quality images that give a real good indication of what, you know, you saw, conclusion, and things need to be referenced appropriately. So anyway, as I was saying, Shima, you may need to go through all these assessments and the way they're going to be marked quite carefully yourself. In a couple of weeks' time, when you guys are on campus, I'm happy to go through all these things again and answer them. As I was saying too, these assessment items are due later on in the semester, so it gives you lots of time to do some research and to prepare everything really well. So they're the assessment items for the Principles of Cardiac Sonography 3. Let me go through the assessment items for Practice of Cardiac Sonography 3. So again, I'm going to just go to the learning guide, which is something that you will be able to access via Views, and I'll scroll down past all the other information in the learning guide, such as, you know, the schedule of activities, right down here to assessments. And you'll see that for the Practice of Cardiac Sonography, there are 4 assessment items. The first one is an imaging evaluation. The second one, a written exam. The third, a practical exam. Those first 3 assessment items will be marked. The last one is a logbook, which, as I said, you can start recording already. The logbook is not marked, but it is what's called threshold. So you do actually need to submit the logbook in order to pass the unit. The imaging evaluation is the first assessment item that will be due, and it's the rationale behind this is to get you guys to critically analyze your own work. So you're going to be submitting 2 cases. Now, like everything else, there are some limitations to this. You're going to have to save some images in JPEG format and include them in, you know, a worksheet. So you won't be saving, looping images in AVI format, but I'll explain. In case 1, I want you to submit images from a patient with a systemic disease, so someone with hypertension or diabetes or chronic renal disease. You provide the indication for the exam, a summary, and then you submit 4. Just go back here, Shima. Shima, you still there?
Just got back, sorry.
How long have you been?
Time. I think you finished talking about that assessment.
Okay, so
yeah.
Am I up to the Practice of Cardiac Sonography assessments?
I guess, yeah, you must be.
Did I talk about the logbook at all?
Sorry, the logbook? No, it's okay for now.
Okay.
Did I miss something about the logbook? Just to...
Not really, just the fact that there's a logbook due at end of every semester. So it's just to make sure that you're traveling along okay.
Yeah. And so you said for the year it was 625.
Yeah.
Is there like a certain number?
Yeah. Let me get to that in just a sec. I'll break down all the numbers for you, Shima. So the assessment items for Practice of Cardiac Sonography, there are 4: imaging evaluation, written exam, practical exam, and the logbook. Let me just mention the imaging evaluation. The rationale behind it is to have you critically analyze your own work. So you submit 2 cases. The first one, a patient with a systemic disease. The second one, a patient with an infiltrated disease. Now, the systemic disease can, someone with hypertension or diabetes or chronic renal disease. The second one, a patient with infiltrative disease, pericardial disease, or a cardiac mass. So they're two quite different cases, two hopefully interesting ones. The key thing is for you guys to submit the cases with some images. So images that have been saved in JPEG format and then are copied and pasted into a Word document. You submit 4 parasternal images, 2 2D images, and 2 Doppler images. Then of those 2, I want you to identify which 2 of those images are best and why they are best. So, for example, if you've acquired a really nice 2D image with the focus, the focal point set appropriately, with the gains well set, with the frequency appropriately selected, etc., etc. You go into, you explain why that's the case. Or if you're going to call up, one of your worst images, say, look, the TGC was not, appropriate set. It's too bright in the near field or too dark in the far field. I should have either reduced or increased the frequency. I could have adjusted the frame rate, etc., etc. So you do that for parasternal images. You do the same with apical images. So again, you submit 4 apical images, 2 2D images, 2 Doppler images, and then you critique your own work. You say what are the best and what are the worst ones. The format, how they're formatted, is down the bottom. Okay, so embed them into a Word document with no more than 2 images per page, just so that they can actually be seen. Label the images and then follow that with an evaluation. Okay, so that's the imaging evaluation, which is due in week 7. Again, it's something I can talk to you guys about in a couple of weeks. Here are the marking rubrics, and hopefully you'll, by reading through those marking rubrics, be able to identify clearly how this is going to be marked. The other assessment items are a little bit easier to get your mind around. There's a written exam at the end of the semester, which will include multiple choice questions, some short answer questions, and some long answer questions. And then a practical exam, which will simply involve 3 imaging stations. So 3 stations at which there are volunteer patients and you are needed to acquire some images. And then 1 station, which has just got some laminated images and some heart models, and you're to identify things at that particular station. The written exam is right towards the end of the semester, and so is the practical exam. Let me just go back here, Shema, and I'll stop. No, I won't stop sharing. Have you got any questions at this stage?
Well, I was just going to ask, are we going to have access to this?
Sorry, Seamus, repeat the question, sorry.
That's got all this information. Will we have access to that?
Absolutely, absolutely. It's already on the VUE site. So these learning guides, so these slides that I've given you today, I'll make them available. They're already available on the VUE site. The learning guides, they're already available via the library and via VUEs. You'll have access to all this information, and you can read through it and ask me, if, having read through it, any questions related to that.
Okay.
So yeah, as I was saying earlier, the assessment items are due later in the semester, just so that you've got plenty of time to work on them. Obviously, don't leave them for too long.
Yeah.
But start thinking about them. But may I suggest that as soon as you get access to VUEs, you start reading through the learning guide, just to make sure what I've said today really you understand. Here's the part you've been looking for, Shema. As I was saying, these slides will be available via VUEs, and there's also a place where you can access information about the logbook via VUEs, so you don't need to write these numbers down or anything, but there you can see, in semester 1 of this second year, there are 400 studies due. Semester 2, there will be 275. So the total for this year is 675. The logbook is always the last assessment item due, and it's always due on the Monday after the practical exam. So the practical exam is always right at the end of the semester, and the logbook is due after that, just to give you as much time as possible to, acquire as many, or to undertake as many exams as you can.
What happens if you don't get to the logbook number?
So, good question. So if, for example, at the end of the semester you passed everything and your logbook was at about, 390, I'd be happy with that. If you passed everything just and your logbook was 300, we'd have to come up with an alternate plan. So it's really important that you work towards that number. It should be, especially if you're going from the beginning of 2018, 400 should be an achievable number. Everyone who's sort of submitted things so far have been able to achieve that. If at any stage you're getting concerned, let me know, okay? Rather than leave it to the last minute.
Pretty slow with the reporting at the moment.
Okay. No worries. Right. So what we should do, Shem, is we should talk when you come on campus for the first time, and we'll talk about your logbook, and we'll see how you're going so far, just to make sure that this is going to be something that you can work towards. What it's meant to be is not a numbers game. What we don't want you guys is just to focus entirely on the numbers. However, this is significantly lower than what ASAR wanted us to demand of you guys. And the reason for that is what we wanted you guys to be doing quality studies, not just a heap of studies that aren't good quality. So I certainly hope by the end of June this year that 400 studies will be achievable. This is an example of the logbook, okay? So each logbook needs to have the following 4 parts. So there needs to be a date for each of the exams that you've done. Oops, sorry, go back. So, and then a unique identifier. So just obviously for privacy matters, use an identification that will enable you to go back and review images without too much difficulty, but obviously something that doesn't include the patient's full name or full date of birth or something. As I was saying earlier, you either call them a ventricular function study, or rather an LV function study, or a valvular function study. And then they're given a cumulative total, a subtotal and a cumulative total. So as you'll see there have been 4 LV function studies, 1, 2, 3, 4. The 5th one's a valvular function study. So the subtotal for is 4 and 1, but the cumulative total 5. So you're just keeping a running tally of all the exams that you do. In terms of expectations, don't try and read all the fine print there. I'll try and paraphrase, but what we want you guys to do is obviously ensure that you keep you'll constantly each week look at the views site, so that announcements that are read, so that timetables and when things are due, you're familiar with that. Because if you do miss an assessment item but you've told me that there's something happening at that time, it's no problem. If it's not until afterwards, then it becomes difficult to make exceptions for that. Make sure that with the case reports and other things that you submit your work, and that things are appropriately referenced. When you come on campus, I'm sure you'll do this just fine, Shem, but just just be mindful that, you know, there'll be volunteer patients there, that these people, you know, give up their time. And so obviously we want to, you know, respect their, you know, show them that, you know, the due respect that, you know, we should as professionals, and work really well with the other students. There's things that you guys should expect from me. As I was saying, all the learning guides are now available. If you don't understand any of them, please let me know. I'll try and give you lots of reminders about when assessment items are due. I hope to assess everyone fairly. The good thing about the assessment, a lot of the assessment items, is because you guys are submitting them online via what's called Turnitin, I'll be able to give you lots of feedback that you'll be able to see. You know, I'll make that available to you, and you'll be able to read all my feedback as soon as I've marked that particular item. And as I was saying, if there is any concern, let me know sooner rather than later. Having said that, if something happens on the day of an exam or something, for example, you know, sometimes things happen, you know, I don't know, you're really unwell, or you're involved, you know, in an accident or something like that. These things are understandable, they happen. Just try as soon as you can to let me know that there might have been any difficulties. These are the people, Shima, that you'll sort of meet this year. Anne-Marie Hennessy is the Dean. You'll meet her once, and myself. Some cardiologists who've been very much a part of setting up the course and part of its, you know, continuing development, Suzanne Eshu and Timothy Tan. A couple of sonographers that you'll see, especially at assessment time, Fernando and Anita. Some other people that you won't, or one person you won't see is Julie. She does a lot of work behind the scenes, but she does a mountain of work in order to make sure that things are done properly in terms of collating exams and things like that. David Tannis, his expertise is congenital heart disease, and he'll give a tutorial for you guys when you come on campus. And there'll be a library tutorial this semester as well at one of the on-campus sessions by the librarian. He'll just give you some tips about referencing and using things like EndNote. EndNote is a reference database that you guys can use. It's a really handy way of storing references and things like that. And it's a free download to all students. So just to let you know about that. There are contact emails that you've got in mind. You're certainly welcome to contact any of these people, including Anne-Marie. She's a really busy person. So may I suggest that I'm the first person you need to go through. If you don't feel comfortable about a certain issue or something and going with me, you're more than welcome to contact those other people. Just finally, if this semester you would like some feedback about images, you're very welcome to copy a study that you've done in DICOM format onto a memory stick and bring it to me when we get together for our first on-campus session on Wednesday, the 4th of April. That's a bit of a typo there. And I'll go through that carefully and give you some constructive feedback, I hope. Sorry, yeah, April the 4th it is. And there's also a competition. So the views site, which you see here, let me just go back to it. The views page, which looks like this. As you can see, there's an image on it, and that's the competition winners from last year. If you've got a really interesting image submitted as part of the competition in JPEG format, according to what I've said on the slide down here. And if you win the competition, your image will be on the home page for the rest of the year for everyone to admire, and for you to remember. So every time you click onto the home page. What I might do, Shima, is let me just, I'll stop share. I might